knock, provide privacy, hand hygiene. Hi, my name is Kim. I'm going to be your student nurse for today. I'm going to be doing a head-to-toe assessment. Can you tell me your name and your date of birth?
September 1st, 1996.
Okay, good. Do you have any allergies?
No.
Do you feel any pain on a scale of 0 to 10, 0 being no pain, 10 being extreme pain? Can you rate your pain?
0.
0? Okay, good. Where are we?
Doctor's office.
Why are you here?
For checkup.
Okay, and do you know what is today's date?
May 1st, 2020.
Okay, good. So Al is alert and oriented times 4. He appears congruent to his age. There are no signs of physical deformities. There are also no signs of any acute distress. He appears to be in good hygiene, and his stature is proportionate to his height and weight, and his mood is content. So I'm going to go ahead and start by assessing your head. Do you have any headache?
No.
Any nasal occlusion? Do you have any excessive drainage in your eyes, your nose, your ears, or your throat?
No.
Have you had any changes in your vision or hearing?
No.
Okay, good. I'm going to go ahead and start just by inspecting. Okay, by looking, I can see that your head is normocephalic, it's still, and there's no involuntary movement. Looking at your skin, it's smooth, it's intact, and there are no abnormal lesions. It's also uniform in color. And I'm going to go ahead and start inspecting your eye features. I can see that it's symmetrical, and you have 2 sets of eyebrows, 2 sets of eyelashes, and two sets of eyes. And then looking at the hair growth on your eyebrows and your eyelashes, it's evenly distributed, so that's normal. I can see that your eyes are clear, they're not cloudy, so that's good. Your sclera is white, and I don't see any signs of irritation or inflammation or redness. So I'm just going to go ahead and check your conjunctiva, okay? Okay, your conjunctiva, it's light pink, it's moist, and there's no signs of irritation or inflammation. Your lacrimal duct. Okay, your lacrimal duct has no crusts in it, so that's good. Now I'm just going to go ahead and do an eye test using this pen light, okay? So I want you to just look at my shoulder as I shine a light on your eye, okay? Good. So now I want you to go ahead and look at this and just follow the pen, okay? Okay, good. So your pupils are equal, they're rounded, and they react to light. They also accommodate. When the pen was going closer to your eyes were constricting, and when I was pulling it away, it was converging. So that's good. That's a normal reaction of the eyes. Now we're going to go ahead and move on to your nose. I can see that your nose sits midline, and looking at your nares, they're symmetrical. Now I'm just going to go ahead and shine a light to check inside. I can see that your septum, it's midline and it's not deviated. There's hair growth in your nares, and it's normal. The skin inside is also uniform with your face, and there were no signs of drainage. I can also see that your nasal labia folds are symmetrical, and there's no drooping on one side versus the other. So that's good. I'm going to go ahead and do a nasal occlusion test. If you could just hold one nose and blow, and the other. Good. So there's no nasal occlusion. Now we're going to go ahead and move on to your ears. So I can see that you have symmetrical ears. The top of your ear is in alignment with your eyes. So that's normal. That's really good. I'm going to go ahead and just look, okay? Okay, good. So your ear, it's uniform in color to your face, and there were no signs of drainage. Now I'm going to go ahead and just palpate, see if there's any tenderness or any swelling. Okay. Okay, I did not feel any lumps, any bumps, or any tenderness in there, so that's good. So now we're going to go ahead and move on to your mouth. I can see that your lips are pink, they're moist, and it's not cracked. Can you smile for me? Okay, a big smile. So I can see that you're not missing any teeth. You have a full set of teeth. They're white, they're clean, they're shiny. Your gums are also pink and moist, and I did not see any bleeding. Do you have any pain in your gums? Okay, so now I'm gonna go look inside your mouth for your tongue first. Can you stick your tongue out for me? Okay, move it side to side. One more, and up. Okay, good. So your tongue, it's midline, it's pink, it's moist, and it moves voluntarily. In your ventral tongue, it was veiny, it was moist, it was pink, and it had a pool of saliva, which is the normal finding that we want to have. Now I'm going to go ahead and look inside your throat. If you could just say ah, say ah. Okay, good. So the mucous membrane, it's pink, it's moist, and your uvula, it's midline. When you said ah, it went up, so that's the normal reaction. And then I did not see your tonsil, so I'm going to go ahead and grade it a 0. Okay? Now we're going to go ahead and just take your carotid pulse, okay? Good. I'm going to grade your carotid pulse 2+. It's regular rhythm and it's equal bilaterally. Now we're going to go ahead and just palpate your lymph nodes, okay? I'm going to start with your preauricular, postauricular, occipital, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and if you could just lift your shoulders, it's going to tickle your supraclavicular. All right, good. So normal results because I could not palpate any of your lymph nodes, so that's what the result you want to have. Okay, now we're going to go ahead and move on to your anterior chest. Have you had any chest pain, any difficulty breathing, any wheezing or snoring, any feeling like your heart's racing, any sputum production? Okay, good. So I'm going to go ahead and start by inspecting. I can see that your breathing, it's even, it's normal. The falling and rising of your chest, it's equal and it's normal. You don't have any labored breathing. And I can see that your skin, it's smooth, it's intact, it's uniform in color. I do not see any abnormal lesions. And your muscle, it's smooth and it's symmetrical. Same thing for your bone structures, they're also symmetrical. So that's really good. So I'm just going to go ahead and do a Turgor test real quick. Good. There's no tenting, so it's a really good sign of hydration. So good job. Now I'm going to go ahead and listen to your heart sound at your Erb's point. It's at your third intercostal space of your left sternum border. I'm going to go ahead and listen for 1 minute, okay? So your heart rate is 79 beats, and that is within the normal range, so that's really good. Your S1 and S2 sounds were audible, and I did not hear any murmurs or any adventitious sounds. The rhythm is also regular. Are you okay?
Yes. Sorry.
Okay, it's okay. And what else can I say? So as for the heart, that's all good. Now we're gonna go ahead and just listen to your lung sounds, okay? I'm gonna go ahead and start with your anterior bronchovesicular. Just take a deep breath for me. Okay, now your anterior vesicular. Okay, now your lateral. Okay, good. So I'm going to ask you to turn around so I can listen to your posterior. Can you face the other way for me? Okay. All right. So this is your posterior bronchovesicular. Take a deep breath for me. In and out. Okay, good. Now for your posterior vesicular. Okay, good. So all of your lung sounds, they were normal and even bilaterally. I did not hear any adventitious sounds, so that's really, really good. Okay, now we're gonna go ahead and move on to your abdomen. I'm gonna have to ask you to just lie down. Okay. All right, have you had any change in or loss of appetite?
No.
Any problems or urgency in urinating?
No.
Okay. Have you had any abdominal pain?
No.
No? When was your last bowel movement?
This morning.
This morning. Is that normal for you?
Yes.
And how often do you urinate in a day?
3 to 6 times a day.
Okay, and that's normal for you?
Yes.
Okay, good. So, if you could just put your hand to the side, thank you. I'm going to go ahead and just start by inspecting your abdomen, okay? So I can see that it's smooth, the skin, it's smooth, it's intact, and it's uniform in color. There is hair growth in the middle. However, it is normal and it's evenly distributed. I can see that you have 2 macules. Are those normal? Yeah? Okay, good. So the contour, it's also rounded and flat. And then the muscle, it's symmetrical and it's toned and it's firm. And the bone structures, they're symmetrical. I do not see any obvious peristalsis movement, any pulsations, or any wave movement, so that's good. Okay, I'm going to go ahead and start just by listening to your bowel sounds, okay? The right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. Okay, good. So I heard normal bowel sounds. I could hear the gargling. And now I'm just going to go ahead and palpate, okay? See if there's any tenderness or any masses. Let me know if you're in any pain, okay? All right. Let me just do that one more time, okay? Okay, good. I did not feel any tenderness or any masses. Was there anything painful in that? Okay, good. So we're done with your abdominal assessment. I'm going to have to ask you to sit back up so we can do your upper and lower extremities, okay? All right. Have you had any changes in sensation, any pain in your arms, any numbness or tingling?
No.
Any feeling of weakness? How about any limitations in range of motion? No? Okay, so I'm going to go ahead and just have you do this. Good. Back here. Good. Okay, so I'm going to start by inspecting. and I can see that your skin is smooth, it's intact, and it's uniform in color. I'm going to go ahead and palpate for tone muscle, okay? Okay, your muscle tone, it's firm and it's smooth and it's equal and it's even. The only thing that I would note on your skin, it's the tattoo on your right arm, the forearm. Any irritation or allergies or any problems with that tattoo? Did it heal well? Okay, that's good. All right, so I'm gonna go ahead and check your capillary refill as well. So just pinch this. Another one. Okay, good. So your capillary refill is less than 3 seconds. That is normal, so that's good. Okay, now I'm just gonna go ahead and just take your brachial pulse. So if you could just... Okay, and now your radial. Good. So your brachial pulse, it's 2+ and it's equal bilaterally. Same thing for your radial pulse, it's 2+ and it's equal bilaterally as well. So that's good. Okay, now I'm just gonna go ahead and do some strength tests. So go ahead and pull my fingers. I'm gonna pull away. I want you to grip my fingers with your whole hand. So grip with the whole hand. Okay. Okay, good. So if you could just extend, flex, good, extend again. And then push down. I want you to push against me, okay? Good. Other way. Good. Now flex. Okay. Push down. Up. Okay, good. Your strength is 5+ on both sides, so that's very strong. Okay. I'm going to go ahead and look at your lower extremities, okay? So I'm just going to go ahead and palpate for any tenderness or edema. Do you feel any pain? No? Okay. Good. So your muscle, it was smooth, it was firm, and it was equal on both sides. I can see that the hair growth, it's normal and it's equally distributed on both legs. There are no signs of swelling, no pretibial edema, no swelling on the joints of the knees and the ankles. Also, you know, just like the hair distribution in your lower extremities, the hair distribution on your upper extremities is also equal, normal, and it's evenly distributed. Okay, good. So now I'm going to go ahead and just check the capillary refill on your feet as well. Okay, the capillary refill is less than 3 seconds. Now I'm also going to go ahead and check for your pedal pulse. Okay, now your post-tibial pulse. Okay, so your pedal pulse is 2+ and it's equal bilaterally. Your post-tibial pulse are also 2+ and equal bilaterally, so that's good. I'm going to go ahead and do the same strength test with your upper extremities. So I want you to just go against, good, down, good. Can you flex your feet like that for me? And up, twirl, good. So the strength is also 5+ equally, bilaterally as well. All right. Have you had any changes in feeling or numbness, tingling? No? Same as your upper extremities? Okay. Any weakness? No. Any limits in your range of motion at the bottom of your lower extremities? No? Good. So that actually completes our head to toe assessment. I'm going to go and just wash my hand for hand hygiene. Okay, so to summarize all the findings for your skin assessment, your musculoskeletal assessment, and for your neurological assessment, all the results are normal unless other than those stated. Do you have any other pain or concerns for me today? That's it. All right, thank you so much. Have a great day.